antibody productions. We've already talked about that yesterday in type 3. The B cells are hyperactive here, and that's our humoral immunity that goes all the way through our body, and the B cells being the cellular immunity, the cellular versus non-cellular. So the SLE antibodies react with the antigen and make the immune complexes. It's really the same type of process as RA, and then it's deposited into connective tissue. So this is a little different now. That makes it a little variation here. So they trigger the inflammatory response, and then you got the tissue damage. And for some reason, the kidneys are very, very susceptible to those complex deposits, and it can damage the kidneys. And there are other organs that can be affected too. But musculoskeletal, brain, heart, spleen, lungs, GI tract, skin, it's just everywhere it could deposit and cause damage anywhere. But the kidneys is such a crucial body function that what the kidneys do. That's a big deal. And Laura was just telling me that her relatives actually died from the cardiovascular issues from RA, and that a lot of times people die from lupus because of the kidney damage. So that's a little bit of a difference there. But it can be, this could affect the heart as well. Lupus can. So we don't really know how this happens either. We don't really know so much about the RA, but it is genetic and environmental and hormonal that are affected. We don't exactly know the cause, but we definitely know that it affects it. So our outside factors like viruses and bacteria and chemicals and drugs and UV light can aggravate the disease. And women that have systemic lupus, they have decreased levels of some androgens that can inhibit the antibody responses. So, women do have androgens. We have estrogen. We have androgens too. So so what sex do you think would have more episodes of instances of lupus? The female, yes, and it's 10 times the incidence of men. So it's usually women of childbearing age where the incidence is 30 times greater than men at the childbearing years. And it is more common in African Americans, about 8 times more common. And then Hispanics and Asians is more common in men as well than it is in Caucasians. So there can be drug-induced lupus symptoms. So that can sometimes drugs can cause that immune complex to start, like procainamide, hydralazine. Oh, I'm sorry. Good grief. Thank you. Hydralazine and isoniazid, and that's a TB drug. I'm pretty sure. So I think isoniazid that could that could be a side effect of the TB drug. But hydralazine, has anybody given that before in clinical? You don't know what that is? Was it for blood pressure? Yes, good point. Yes. So we have to be careful about some of those. And our biologic response modifiers for RA can cause a lupus-like syndrome to go on top of the RA. So that's kind of unfortunate for those people. All right, we have 3 classifications of it. It can be systemic when you got SLE, systemic lupus erythematosus. That's the one that we're going to address the most, but we got some other. Systemic is one or more of cardiovascular, central nervous system, kidney, lungs, or musculoskeletal. So if it's in any of those systems, it's considered to be systemic. Then drug-induced is associated with some time neoplastic drugs, and then the ones that are on the previous page too. And then discoid is limited to the skin, and so it is not systemic. So it's a localized area, but it can cause problems with people's body image and such because it causes rashes. It can cause scarring, and it's worse when the person is getting a lot of sun exposure, the UV light, and it is definitely a localized body image issue. So what we're going to see with lupus is painful or swollen joints. So you can see that, but it doesn't say that it's different, that it's symmetrical and in the synovial specifically. It could be, but it does not have to. And you can have unexplained fever and extreme fatigue, and boy, that's just clear as mud, and then it's just trying to figure it out from just fever and extreme fatigue. But a fever can be, if you already have been diagnosed with lupus, if you had not been running a fever and then you start running a fever, that can be a sign of the flare-up of the lupus. And the thing that's different in the wolf part is the red rash on the face, and it's like sort of like a mask, and it makes you sort of, whoever named it thought that it made you look like a wolf. And you can have alopecia, the loss of hair, and you can have the like Raynaud's syndrome, where the blood just kind of goes out of your fingers, like it's nice and pink on the end, and then all of a sudden it looks like all the blood's running out of it. And so that can happen with this condition. Sensitivity to the sun and rash can be caused or exacerbated by the sunlight on the skin. And you can have edema in your legs and around your eyes, ulcers in your mouth, and enlarged glands. And we had the enlarged glands in RA also. But a lot of these are kind of different, aren't they? They're on this particular page. The course of the disease is mild in most people, and they have remissions and exacerbations. But if you are in an active disease state, then you are at greater risk for infection. And because of the treatments, really. We talked about that in RA too, didn't we? And the symptoms definitely mimic those of RA, the fever, anorexia, the malaise, and the weight loss. Arthralgia, symmetrical polyarthritis that's rarely deforming. You're not going to see that swan neck thing, and the boutonniere, and the ulnar deviation and all that. And you can actually have osteonecrosis and muscle atrophy. That is a possibility. You can have nervous system involvement, and it's usually temporary. It's not going to stay with you forever. And there is a possibility of seizures and depression and stroke. Man, that's just all over the place, isn't it? It's like, how in the world does anybody ever put their finger on it? I think it'd be so hard to be a general practitioner person, a primary care person, and trying to figure out this thing. This is a really busy slide, but it's got some true stuff on it. You can have pleural effusions, which you can have that. You can have that with RA too. You can have heart problems with RA. Lupus nephritis, so that's different. And arthritis, and here's the Raynaud's phenomenon. You got the whiteness over the tips of the fingers, and you got that butterfly rash. It's sort of, I guess that's what makes you look like a wolf. But it can be varied as far as how serious it is and how extensive it is. So anyway, this one's just a closer look picture right there. And here's the Raynaud's phenomenon. You've got the whiteness due to inadequate blood flow, and there's blue. It turns blue as the oxygen's depleted in the tissues. And then all of a sudden it just comes back. It's really strange. Now that's the discoid up in the right upper corner. That's the one that's not systemic at all. So the multi-system effects, the renal and pulmonary, the effusions, and you can have pneumonia, you can have pericarditis, you can have pancytopenia, which What would pancytopenia be? So you're just not producing any blood cells hardly. And agranulocytosis was really not producing the granulocytes, like the neutrophils and the eosinophils and the basophils. That's the agranulocytosis. But the pancytopenia, that's all three types of blood cells. Okay. And in the discoid, you can have hives and the red lesions on the fingertips, and you can have like little splinter hemorrhages that just look like little lines. And about 50% of people with the systemic lupus have renal problems with that, and up to 10% will develop renal failure. That's not. And then you have hematologic problems, anemia, leukopenia, thrombocytopenia. That's the pancytopenia, isn't it? That's what we're talking about. GI manifestations, anorexia, nausea, abdominal pain, diarrhea. And that sounds like a listing of drug side effects, doesn't it? And then the survival rate is improved if you get an early diagnosis and you have more options for treatment. And women this is really interesting. Now, I put a star by it on my notes page. The women that conceive while they're having active disease flare up, they have an increased incidence of spontaneous abortion or stillbirths, or they have prematurity and intrauterine growth retardation if they conceive with the active disease. But and it can cause congenital heart block in infants, and the prognosis is varied for the fetus, but any heart damage is permanent. The prognosis is okay if they don't have a really bad heart damage. They can have a normal life if they didn't experience the heart damage. But if the woman conceives when she's in remission, there's hardly any issue for the fetus, and there's not a negative outcome. That would be a real difficult timing situation. It's really that the lupus is attacking the fetus. It seems to attack the heart of the fetus more than anything else, but it attacks kidneys of the actual person who's got the lupus. So it's just very strange. But it is hormonal related, though, to have that change when your hormonal things are going to work more normally in your pregnancy if you conceive when you're not having experience in all those complex illnesses. So I think that would be a very, very touchy situation trying to time pregnancy. That would definitely be so difficult. I'm sure that's not worked out well for a lot of people. Okay, this is going to be some repeat. We got our NSAIDs. There's rheumatoid therapy besides supportive care. Skin arthritic manifestations, we can do the plasma again. So you've got the same exemplars or whatever, or the prototype drug. That's what I want you to know about the eye issues and such. And you can have severe and life-threatening manifestations. So your corticosteroids will have to be in high doses if it's a really bad flare-up. And kidneys aren't working or something like that, and they may be taking 40 to 60 milligrams of prednisone a day and then taper it as soon as they start to see some response. And we can't give that to them forever because that's too often much. And with discoid therapy, topical cortisone is used a lot to decrease the inflammation, and it helps the skin lesions to fade also. And with the anti-malarial drug, the Plaquenil, it's decreased the absorption of the UV light by the skin, and you need to have the eye checkups again every 6 months because of that uveitis that we saw in RA. And again, the diet they recommend is the low-fat, mostly vegetarian diet, or like the Mediterranean diet. That's more like fish and olive oil and not as much red meat. And so that can lessen the skin symptoms, especially with the discoloration, if you eat the Mediterranean diet. Okay. But just, I've got this written like 3 or 4 times about the Plaquenil, so I guess you got the eye thing, right? Do you think I want you to know that?
Yes.
Okay. But it could cause blindness. All right, so Tylenol or NSAID you can use for muscle pain and inflammation. If they got renal or central nervous system involvement, like the methotrexate and the azathioprine, the Imuran, those are some of the ones that those alkylating agents we talked about is a DMARD for RA. And it can increase the risk for infection, of course, so you want the people to avoid crowds or people who are sick because they are susceptible to infection on those medications that are suppressing the immune system. And monoclonal antibody is different. This is a different one. It's belimumab, B-E-L-I-M-U-N-A-D. So that one is one that they use more for lupus, and then the Remicade is for the RA more than likely. And you don't want to take any live vaccines for 30 days before any of these treatments that decrease the immunity, because they might not work. All right. So we got immunosuppressive agents, the cyclophosphamide or the azathioprine. Those are related, and those are things that they're used to prevent transplanted organ rejection. We used to have kidney transplant patients on the first unit that I worked on when I was out of school, and they would give the azathioprine for that, and not for chemotherapy for cancer. It could be used for that, but it works better than prevent transplanted organ rejection. But cyclophosphamide azathioprine is very, very similar as far as action and side effects. And then the clients are at risk for infection and decreased immunity. And then you can be, if you have that, if your immune system is not the best, then you can have a risk for malignancy. You remember talking about that in Winch 12, that the people that are born without immunity are real susceptible to getting lymphomas, like even in little children. So the bone marrow depression is an issue, and definitely risk for infection. And you would use the same interventions as like the cancer patients on chemotherapy. Because cytoxin, you need to drink lots of fluids, because it can cause hemorrhagic cystitis. It can irritate it so much that it bleeds. Okay, so we're going to have to avoid sun exposure, and we need at least like 30 SPF. You can use more than that if you want to. It used to be 15, it's pretty much 30 now. And then you can use topical steroids when it's skin lesions, especially the discoid. Okay, this is a real important thing. Estrogens aggravate this, and of course, most of the victims of this disease are women, and so avoiding estrogen therapies, that could be a big issue. And birth control pills, they've got BCPs as birth control pills, can trigger an acute episode of lupus. So, and this is, pregnancy can trigger an episode also, unless they are conceived in remission. If they conceive when they're not having the symptoms, then you're not likely to even have any exacerbations during the pregnancy. But if you didn't conceive in remission, then you are likely to have the hormone issue. That is really the fingerprint. Yeah, they may do and there may be some other people, because there may be some other agents that might cause that. It really yeah, that's really difficult to try to prevent pregnancy. You can use barrier methods, of course, or IUDs, but that's a difficult deal. So, okay. If the lupus nephritis progresses to the end-stage renal disease, then dialysis and kidney transplantation could be an option. And you can actually have exacerbations because of stress, just emotional stress. You've got physical stress too, but they can use guided imagery and yoga and massage and aromatherapy. They talked about that a little bit in RA too. So you want to avoid hair dyes and frostings and perms when you're in active disease symptoms going on. And if you are in a remission, then that's probably okay. So you don't get pregnant and you don't color your hair when you are having active disease. So that's going to be a tough thing too. But one of the most important things, though, talking about the kidneys, really think about joints mainly for RA, and of course there's lots of other things. It is systemic, but then you really think about kidneys for lupus, because that's what causes the most problems for people, or that's the biggest cause of death. So we've got to be really cognizant as nurses to evaluate whether they're having normal urine output and looking at their labs and everything. But if you don't talk to the patient, and they have different urinary output, or they're having like pain in their back, if they're getting any common nephritis or something like that, if they have a urinary tract infection, that could be very serious.
My mom actually has mild systemic lupus.
Oh,
It's like super mild. She's had it for the past 2 years. She's also hears her third.
Oh my God.
Yeah. So when we first found out, I was like 12 years old, but it really affects like her hand joints. So we're making it essentially swelling. It's not necessarily. It's not like RA. Just there's days that it's super sensitive versus not. And then she had a lot of alopecia, and then she also had the mass. But the hair dye is not avoidable for her. But she would get sick constantly.
She can at least wear gloves.
Yeah, absolutely. But she also had, she was a little overweight when the diagnosis happened, and she had a bariatric surgery, and her flares reduced after her bariatric surgery.
So you need to, obesity can really be an and more estrogen when you eventually you do have more estrogen in your body susceptible to breast cancer when you're obese, because it does change the hormones. So if you do control the obesity, that's a good point, and I don't think we really have said that.